Fashion Now Network for All, in short, CNN for All, Urbana, Illinois, USA.
And Bethel House of Refuge, Muhammad, Illinois, also in the USA, presents this week's breaking news in wellness and health for all people and for all professionals. Hi, I'm the Pete of Dr. Z and Pete. Of course, this is Dr. Z. Presently, I'm the CEO of Bethel House of Refuge in Muhammad, Illinois. Formerly was the executive director of a prison ministry in this area. And previous to that, I was president of a commercial construction company operating the central Illinois area. This fellow right here is my good friend, distinguished co-host, and our medical guy, Dr. Alex Rama Zechariah, MD. Hi, Doc. Good to have you with us. Doc is also a medical professor, and he is the CEO of CNN for All. Recently, Doc was the chief medical officer, the medical director of Provena, now Presence United Samaritan Medical Center in Danville, Illinois, and held that position through all of 2008 and part of 2009. Prior to that, he was dean of one of the top 12 medical schools out of 300 plus medical schools in India, Christian Medical College, Ludhiana, India. Doc, with his wife Prema, also a retired physician and professor, specialized in maternal and child health care, spent 43 years at Christian Medical College in Ludhiana, first as medical students and then as faculty until they retired in the year 2000. Doc and Prema now live in Urbana, where they've resided since 2005. Doc, got an outstanding resume. I'm privileged to be with you and have you here with us on this week's Breaking News in Wellness and Health. I'd like for you to tell the people what we are about here.
Please note that this is for your information only. This is not medical advice. Don't change your treatment based on this info. You may mention this to your physician, but remember, this is only for your information.
Absolutely. Mention it to your doctor. Invite him to watch with us. If you need to communicate with us, you can do it by email at breakingnews@cnn4all.com. That's breaking news at cnn4all.com.
Or you may write to us, CNN for All, P.O. Box 17494, Urbana, Illinois, USA.
Let's jump right in. We're going to jump into this new media face. Facebook interests could help predict and track and map obesity. You know what? I know that's for sure. The higher percentage of people in a city, town, or neighborhood with Facebook interests suggesting a healthy, active lifestyle that lower that area's obesity rate. At the same time, areas with a large percentage of Facebook users with television-related interests tend to have higher rates of obesity. Such are the conclusions of a study by the Boston Children's Hospital researchers comparing geotagged Facebook user data with data from national and New York City focused health surveys. I saw a Facebook thing, and I know this woman, and she's chunky, and everything she had on Facebook was about food.
The study by Rumi Chunera and team published the paper titled Assessing Online Social Environment for Surveillance of Obesity Prevalence in +1 this year. To connect the dots between Facebook interest and obesity, Chunara, Brownstein, and their colleagues obtained aggregated Facebook users' interest data. What users post to their timeline, like and share with others on the Facebook from users nationally and just within the New York City. They then compared the percentages of users interested in healthy activities or television with data from two telephone-based health surveys, the U.S. Center for Disease Control and Prevention's Behavioral Risk Factors Surveillance System.
I'll bet Mayor Bloomberg is shouting with this data. The data show that in places where Facebook users have more activity-related interests, there is a lower prevalence of obesity and overweight. They reveal how social media data can augment public health surveillance by giving public health researchers access to population-level information that they cannot otherwise get. The study also bolsters the case for using social media as a means for delivering targeted interventions aimed at reducing rates of obesity and other chronic diseases. Excuse me, as applicable. I'm telling you, I see a lot of pictures of meals and food and everything on Facebook, and I wonder, you know, isn't there something else you'd like to look at besides a plate? Attention baby boomers, get screened for hepatitis C. If you were born from 1945 to 65, talk to your doctor about getting tested for hepatitis C. Baby boomers are 5 times more likely than other adults to be infected. In fact, 75% of adults with hepatitis C were born during these years. More than 15,000 Americans, most of them baby boomers, die each year from hepatitis C-related illnesses. Doc, you got any idea why this is so?
That's we are just coming to.
All right.
And this is not absolutely known. The word hepatitis means swelling of the liver. Hepatitis is most often caused by a virus. In the United States, the most common type of viral hepatitis is hepatitis C. Hepatitis C is primarily spread through contact with blood from an infected person. The reason that baby boomers have the highest rates of hepatitis C is not completely understood. Most baby boomers may have become infected in the 1970s and the 80s when the rates of hepatitis C were the highest.
Well, they have that in prison and a lot of drug-related ones. The only way to know if you have hepatitis C is to get tested. Early detection can save lives. There's a simple blood test to determine if a person has ever been affected with hepatitis C virus. It is estimated that one-time testing of everyone born during 45 through 65 will prevent more than 120,000 deaths. You know, there's a lot more of donating of blood in these times than there ever was before. Isn't that right, Doc? Well, we got to be careful. You need to be tested. If you have any concerns, it's a very simple blood test. Hey, Doc, we're going to weight loss programs via virtual reality. Weight loss is a topic of concern for nearly 36% of Americans who are considered obese. There are many barriers that can interfere with weight loss. For those attending face-to-face weight loss programs, you know, they get all paranoid. They're going to see I'm fat. Barriers can include travel, conflict with work and home, need for child care, and loss of anonymity. You know, planes are now saying if you're obese, you're paying for 2 seats, and that affects them in their head as well as their pocketbook.
The study from the University of Kansas Medical Center by Deborah Sullivan and team, Improving Weight Maintenance Using Virtual Reality, Second Life, was published in the Journal of Nutrition, Education and Behavior, June 2013. 20 overweight and obese individuals, after 3 months and then 6 months of a weight loss program at a weekly clinic delivered via face-to-face or virtual reality. They found that virtual reality favorably with face-to-face for the weight loss and may facilitate greater weight maintenance.
Yeah, some people don't go to Weight Watchers because they don't want to see anybody. Although we have found weight loss was significantly greater for face-to-face compared to virtual reality, weight maintenance was significantly better for virtual reality. You don't have to do that publicly. You know, and it makes it easier. That's good news. Hey, we've got a national survey with highlights perceived importance of dietary protein to prevent weight gain. Atkins diet, Zone diet, South Beach diet, all them others, et cetera. Chances are you've known someone who's tried a high-protein diet. In fact, according to International Food Information, 50% of consumers were interested in including more protein in their diets, and 37% believe that more protein helps with weight loss. What do you think, Doc?
In this new study published June 2013 in the Journal of Nutrition, Education and Behavior, researchers from the University of Minnesota found a relatively high proportion of women who reported using practice of eating more protein to prevent weight gain, which was associated with reported weight loss.
Oh, the women in Minnesota. Most women correctly identified good protein sources, and the majority could indicate the daily percentage of dietary energy recommended from protein. That means they're well informed. Reported use of this practice was related to self-reported weight loss over 2 years. Given that the majority, boy, this is bad news, Doc, the majority of Americans are overweight, identifying the most effective practices and related factors surrounding successful weight loss and the prevention of weight gain are very, very, very important.
And so this is high protein diet has its limitation. It shouldn't be all protein.
Right. Now check this out, Doc. Everybody's whining about cell phones, but here we go. Using mobile phone apps and weight loss programs. Mobile phones using text messaging and monitoring have been shown to be useful additions to the health program. You know, you could be eating a big burger and a text message comes on and goes, I'm just kidding you. The objective of this study was to develop and evaluate a weight loss intervention delivered by a smartphone app that supported individuals embarking on a diet and that was evidence-based. Researchers developed and tested a mobile phone app that was used to support individuals embarking on a partial meal replacement program, MRP.
Emily Brindle and team published this year in the Journal of Telemed Telecare that data suggested that users of mobile phone support application were more engaged than those using the control application. Women in the intervention group reported a greater increase in positive effect, that is mood, than those in the control group.
Ooh. The support app has the potential to increase positive mood and maintain motivation during weight loss program. You know, people that are on diets are usually grumpy, so that app's going to be healthy. Hey, we've got a health song, don't we, Doc? Come on.
Eat more. Yeah, eat more.
Yes, eat more.
Yes, eat more.
Eat more. I thought we were going to go with eating less here.
More of veggies.
Oh, veggies.
Whole grains.
Whole grains.
Fruits. Go nuts on nuts. Eat more. Yes, eat more. More of veggies, whole grain, fruit, go nuts on nuts. Exercise more.
Oh, exercise more.
Walk, jog, run, bike, treadmill, elliptical,
till soaked in sweat.
Till soaked in sweat. Exercise more. Walk, jog, run, bike, treadmill, elliptical, till soaked in sweat.
Oh, yes.
Eat less.
Eat less.
Yes, eat less.
Eat less.
Less of fried food.
Less of fried food.
Sugar.
Sugar.
Starch.
Starch.
Say no to soda pop.
Absolutely. Say no to soda pop.
Eat less.
Eat less.
Yes, eat less. Less of fried food, sugar, starch, say no to soda pop.
I'm all for that, Doc.
Exercise more, 5 times a week, half hour or more, till soaked in sweat.
Oh,
exercise more, 5 times a week, half hour or more, till soaked in sweat.
I hope you enjoyed our health song. We want to thank Science Daily for all our information. Also, the City of Urbana's UPTV production coordinator, Jason Liggett, and the production intern, Caleb Serpentis, as well as the UPTV station manager, Jake Schumacher. Thanks for watching. We'll be back soon.
Welcome to Louis. Now, around home, it's clear to me you got to play it safe around electricity. Now keys go here and fingers go here, but smart little buddies know they don't go here.
Dumb only bugs go here.
If there's one thing I know about radios and dryers, you never use them around baths or showers.
I get the idea.
You gotta play it safe around electricity. You gotta play it safe around electricity. Ah, yes, you gotta play it safe around.
Compassion Now Network for All, in short, CNN for All, Urbana,
and Bethel House of Refuge, Muhammad, Illinois, in the USA, presents this week's breaking news in wellness and health for all people and all professionals. Hi, I'm Pete of Dr. Z and Pete, and this is my good friend, my distinguished co-host, amen, and our medical man right here on the job, Dr. Alex Rama Zechariah, MD. Doc is also a medical professor, and he's the CEO of CNN for All. This is breaking news in wellness and health with Dr. Z and Pete. Intermittent fasting may help those with diabetes and cardiovascular disease, this study suggests. Intermittent fasting is all the rage. Intermittent fasting, fasting on a given number of consecutive days or alternate days, has recently been hailed as a path to weight loss and improved cardiovascular risk. But, big but here, scientific evidence showing how such regimes affect human health is not always clear-cut. It's about...
James E. Brown and team published a paper titled Intermittent Fasting, a Dietary Intervention for Prevention of Diabetes and Cardiovascular Disease, a question mark, in the British Journal of Diabetes and Vascular Disease this year, 2013. The study suggests that fasting diets may help those with diabetes and cardiovascular disease alongside established weight loss claims.
Well, the basic format of intermittent fasting is to have alternative days eating normally with days when calorie consumption is restricted. This can either be done on alternate days or where 2 days each week are classified as fasting days. These types of intermittent fasting have been shown in trials to be as effective or even more effective than counting calories every day to lose weight. My goodness.
Skip a meal.
That's right.
Intermittent fasting might achieve much of the benefits seen in bariatric surgery, but without the cost, restriction on numbers and risks associated with surgery. Proponents claim that in addition to weight loss, the diet can lead to longer life and protection against diseases, particularly conditions such as dementia and Alzheimer's disease.
Oh my goodness, that's good news. Let's get on and try that out for yourself and see that it works. Check this out, Doc. Higher intake, this is what you've been saying all the time, higher intake of fruits and vegetables may reduce the risk of bladder cancer in women. The University of Hawaii Cancer Center researcher Song-Yi Park, PhD, along with her colleagues, recently discovered that a greater consumption of fruits and vegetables may lower the risk of invasive bladder cancer in women. Good news for women.
Published in the Journal of Nutrition, August 2013, where Park and her fellow researchers analyzed data collected from 185,000 older adults over a period of 13 years, of which 581 invasive bladder cancer cases were diagnosed, 152 women and 429 men. The data also suggests that women with the highest intake of vitamin A, C, and E had the lowest risk of bladder cancer. No association between fruit and vegetables intake and invasive bladder cancer were found in men.
That's unusual, and we'll have to get back to you on that. But ladies, get your fruits and veggies. It's going to help you in the long run. Go on and volunteer. It could be good for you. Volunteering may be good for your health, reveals a large systematic review and meta-analysis led by University of Exeter Medical School in the UK.
Carolyn Jenkinson and team published the study in BMC Public Health, August 2013. The University of Exeter has the most active student and alumni volunteering rates in UK. Some observational evidence point to around a 20% reduction in mortality among volunteers compared to non-volunteers in cohort studies. Volunteers also reported lower levels of depression, increased life satisfaction, and enhanced well-being, although the findings have yet to be confirmed in trials.
You know, it seems to prove that the biblical mandate, it's better to give than receive, is true here. World care prevalence of adult volunteering varies with an estimate of 22.5% in Europe, 36% in Australia, and 27% in the U.S. That's the volunteer rate. Volunteers commonly cite altruistic motives for their habit, giving something back to their community.
That's what you said.
That's exactly
Isn't
right.
it more blessed to give
Yes.
than to receive?
Absolutely. Check this out, Doc. In mild strokes, you'll have to describe that. Ultra early treatment may eliminate the risk of disability. Talk to me.
In the case, you get very early signs of stroke. In the sense you would feel dizzy, or you may have a slight, an early asymmetry of your face, and so on. We would cover that more later.
All right, excellent. In the case of mild or moderate strokes, getting treatment ultra fast is within 90 minutes of experiencing symptoms, greatly reduces the risk of a suffering disability. That means you've got to be self-aware. The American Heart Association, American Stroke Association recommends getting to a hospital within 3 hours of the onset of stroke symptoms. According to guidelines, clot-busting drugs may be given to treat stroke up to 4.5 hours after the onset of these types of symptoms.
You have a question?
Yeah. A stroke is what?
Yeah, stroke is a paralysis.
And it's caused by clot?
Clot,
where?
Clot or bleeding in the brain.
Okay. All right, great. That's excellent. So now you know what a stroke is if you didn't before.
And Peter Ringleb and Patrick Michael paper entitled Ultra-Early Intravenous Stroke Thrombolysis, that's clot busting, do all patients benefit similarly? Published in Stroke Journal, the American Heart Association, August 2013, from the Department of Neurology at Helsinki University School Hospital in Helsinki, Finland. Ultra-early treatment increases the likelihood of excellent outcome in patients with moderately severe symptoms, and in secondary analysis also in those with mild symptoms. So the early signs of stroke, you must get to the hospital.
Excellent. The study found that survivors with mild to moderate strokes who were given the clot-busting drugs in the first 90 minutes of the recommended time window had little or no disability 3 months later compared to those who were treated between 90 and 270 minutes.
The early recognition, the early symptoms recognition is very important.
Okay.
And we have a song for it next time.
Okay.
How to recognize stroke early.
All right, excellent.
Ultra-early treatment increases the likelihood of excellent outcome in patients with moderately severe symptoms and in secondary analysis, also in those with mild symptoms. All measures must be taken to reduce onset to treatment time as much as possible. So we would bring this subject again next time and have a song for that.
Okay. So that's good news. I mean, this early treatment stuff is helpful, right?
And also early recognition, early treatment, you are back to normal.
Okay.
We are back to stroke.
Oh, we're back to stroke. Stroke risk similar among men and women. Smokers worldwide. Smoking cigarettes may cause similar stroke risk for men and women. But women smokers may be at greater risk for a more deadly and uncommon type of stroke. When compared to non-smokers of the same gender, smoking increases the risk of having any type of stroke by 60 to 80% in women and men.
This dangerous kind is the one that bleeds.
Oh my goodness.
This new finding is published in the American Heart Association journal Stroke, August 2013. Researchers compared data from more than 80 international studies that were published between 1966 and 2013. They found that smoking is linked to more than 50% greater risk of an ischemic stroke, the most common stroke, one that is caused by blood clot in both men and women. However, for the more deadly type of stroke, the one that is caused by the brain bleed, known as a hemorrhagic stroke, smoking resulted in a 17% greater risk in women than in men.
Oh my goodness. The study also found evidence that men and women who smoke can significantly reduce their own risk by stopping smoking. Cigarette smoking is a major risk factor for both men and women, but fortunately, quitting smoking is a highly effective way to lower your stroke risk. Stop.
We have a visitor.
We do have a visitor. I saw a guy in the green room. Who is that in the suit tie?
We'll call him now.
Okay, let's call him.
Eat more, yes, eat more.
Eat more?
Yes, more veggies, whole grain fruits, go nuts on nuts.
Who are you? Who is this fella?
Oh, I'm Dr. Johan, a world-famous biofeedback specialist.
Oh, you're the biofeedback specialist.
That's correct. Eat more.
Eat more, Doc?
Yes, eat more. More veggies, whole grains, fruits, go nuts on nuts.
I thought we were going to eat less.
Exercise more.
Exercise more?
Walk, jog, run, bike.
Oh, really?
Treadmill, elliptical. Till soaked in sweat.
You're going to get soaked in sweat in that thing.
Exercise more.
Exercise more.
Walk, jog, run, bike.
Walk, jog, run, bike.
Treadmill, elliptical.
A treadmill, elliptical.
Till soaked in sweat.
Absolutely, I like that idea.
Eat less.
Here we go, eat less.
Yes, eat less.
Less what?
Less of fried foods, sugar, starch. Say no to soda pop.
Absolutely no.
Eat less.
Eat less.
Yes, eat less.
Eat less of what, Doc?
Less of fried food, starch, sugar. Say no to soda pop.
I'm all for that. What else?
Exercise no.
Oh, yeah.
5 times a
5
week.
times a week?
Half hour or more.
More
Till
sweat.
soaked in sweat.
Oh, yes. Exercise more. 5 times a week.
Half hour or more. Till soaked in sweat.
You're not only a biofeedback expert, you're not a bad singer.
Oh, thank you.
Come back and visit us, will you?
Who is this guy?
Who is this guy? I'm the Pete.
Yeah, and this guy.
Who's that guy?
Oh, I'm Dr. Zachariah.
All right, we got 2 doctors here today. Good news, we will be back next week, but in the meantime, we'd like to thank all the people that helped us put this program together. Science Daily for the info, our City of Urbana UPTV production coordinator, Jason Liggett, the production intern, Caleb Serpenis, and of course, the station manager, UPTV, Jake Schumacher. Thanks for being with us. We'll be back next week with more breaking news in wellness and in health.
And you're not thanking me?
Oh, thanks, Dr. Johan. Sorry, I didn't mean to eliminate you.
Oh, thank you.
Come back and see us, will you?
Certainly.
All right.